Hey everybody, welcome to Dancing Around Plantar Fasciitis. This is a virtual workshop for any of my dancers who are experiencing foot pain, chronic plantar fasciitis, or really even any ankle issues. I think that you will find this workshop to still be helpful for those problems. If you're not a dancer, I definitely still think you're going to get a whole lot of information out of this. Plantar fasciitis is something that affects a lot of different people, not just dancers. So I think that you would learn a lot of awesome exercises and ways to better manage your own plantar fasciitis, whether you are a dancer or not. Really quickly, before we get started, I just want to remind you guys, if you are not already members of my Elite Insiders, if you're not subscribed to my newsletter, be sure to do that. You can do it through the link there's a link in my website. Also, if you follow me on Instagram at Pointe Wellness or at Pointe Elite, there is a link in my bio to subscribe to the newsletter there as well. Being an Elite Insider will give you access to all sorts of exclusive dance medicine content, health and wellness tips, and workshops just like this. You'll be the first to know about anything new that I've got going on. There's also, special discounts and things that I run through there. So make sure that you guys do subscribe to that. I will be sending out the link for today's workshop to my newsletter subscribers on Wednesday. So if you didn't catch it live, you will be able to see it then. I also want to make sure you guys, if you haven't already caught it, on my blog, I do have an entire blog post dedicated to plantar fasciitis, as well as a free download of an exercise, helpful exercises that you can do if you are struggling with plantar fasciitis. That's actually where the idea for this workshop came from. I posted the free guide, a link to the free guide on, I think, my Facebook page, and I had a bunch of dancers respond saying that they've been struggling with foot pain and plantar fasciitis and how helpful it would be to get some exercises for it. So from that, I decided that there was probably enough need to go ahead and do an entire workshop on it. So I hope you guys find this really informative. And as always, if you have any questions, don't hesitate to reach out to me. You can do it through my Instagram page. Again, I either have at Pointe Wellness, that's my physical therapy business side of things, as well as Pointe Elite, which if you are a dancer and you have not followed me on Instagram on that page, be sure to do so. That's the page where everything dance specific. You're going to find all my dance specific tips on Pointe Elite. All right, so let's go ahead and jump right into the content. So I want to just give you guys a little bit of a background about what exactly plantar fasciitis is and a couple of tests to actually check and see if this might be what you are struggling with itself. So typically there's a very pinpoint spot that if you are suffering from plantar fasciitis that you will feel. So where you find that is if you go to your heel, right where your heel bone is, that's called your calcaneus, just kind of on the other side of that bone. So almost right where the arch of your foot meets that heel bone. If you kind of give a little push there, again, it's going to be mostly more on the inside part of the heel. That typically is where, if you are experiencing plantar fasciitis, that's typically where you're going to feel it. When you give a little push, usually you kind of jump. That's a great way, quick and easy way to diagnose if it might be plantar fasciitis. The reason that spot is affected is that's actually where the plantar fascia inserts into the calcaneus. So the plantar fascia is a really thick structure on the bottom of the foot, and it helps give us support through the arch, and it helps absorb shock when we're standing on our feet. And it's a very thick structure, and it's not a muscle, so it doesn't contract and lengthen and shorten like a muscle does. It's fascia, and fascia is basically kind of a good way to think about it is when you get a raw chicken breast, that thin layer of tissue that's on top of the chicken that you can kind of peel away. That's essentially what fascia is, and we have it between all our muscles throughout various regions in our body. And then again, on the bottom of the foot, it's just a really thickened piece of fascia. And so it basically starts up like just where the toes are, goes down through the arch of the foot, and connects into the calcaneus, okay? So it covers that entire span of the foot, connects into each one of the toes. And so it inserts into that calcaneus kind of right where that spot is, again, kind of just on the inside part of the bone there where I had you palpate. So that generally is where you will feel pain if you have plantar fasciitis. However, it can radiate anywhere throughout that plantar surface of your foot. So anywhere in the arch, we can still, it could be possibly that you do have plantar fasciitis. Basically, it's an inflammation of that tendon. Now that fascia. Now what we do know is that it's not an acute inflammation. It's more of a chronic, so it's long-standing. So we don't see the normal inflammatory markers like we would with an ankle sprain, for instance. Generally, there's not swelling, although there could be some redness, warmth, those types of things. And even if we were to look at it from the inside, we don't necessarily see the same cells and different nutrients in there that are actually in response to inflammation, indicating it's not an acute issue or a new issue. It's more of a chronic degeneration of that tissue. And because of that, we have to treat it so. So it's a little different than just rehabbing an ankle sprain. It is something that doesn't go away quickly. Most people that have plantar fasciitis, it takes a good amount of time for them to actually recover from this. It's not something that you can rehab in 1 or 2 visits usually. Although you may start feeling better in 1 or 2 visits, it's a long-standing problem for most people. And so we have to look at it in terms of a long-term solution. What's going to make it feel better now, and then what is going to carry you through to make sure that 3 months from now it's not still creating a problem. So there are a couple other things that we generally see in somebody that has plantar fasciitis, one of which is a lack of mobility in the foot and ankle. So the 2 places that we're looking at mobility are in the big toe and then also in the ankle joint. So in the big toe, we're looking for what's called extension. So that is pulling the toe in the direction of my nose, this way. So in my big toe, I should be able to get roughly 80 to 90 degrees of extension. I actually have pretty limited extension in my toe, so ideally you'd have a little more than this. But for somebody that has plantar fasciitis, generally when they pull that toe back, they will feel that stretch through the bottom of the foot, and it very well could reproduce their symptoms. And so I'll show you guys some exercises for how you can get that mobility back. The second place is in the ankle, into a direction we call dorsiflexion. So again, that's pulling the toes in the direction of my nose. Ideally in the ankle, we want to get definitely, so 90 degrees would be straight up and down. I'm going to show you on this ankle. So 90 degrees would be a 90-degree ankle, or angle between my foot and my leg. We should have at least 90. However, normal would be past that. So I really need to be able to get 10 to 15 degrees of dorsiflexion. So past that 90-degree mark, or 0-degree mark if we count 90 to 0. And so I should be able to go past that. The way that I can quickly check this is if you get your foot up against a wall. I'm going to use a foam roller, so really anything that you can kind of put your foot up against, because it is kind of hard to see if you can clear that, if you can get past it. So I'm going to want to sit so that my foot is at that 90-degree marker up against the wall or foam roller. And then I'm going to try to pull my toes back. If I can pull my toes back away from the foam roller and the wall, I know that I have more than that 90 degrees or 0 degrees of dorsiflexion, okay? So I need to be able to get past that. The actual angle for the normal person doesn't matter too much. Your physical therapist definitely will measure that angle to make sure you're progressing, but really you just need to know, can you get past 0 degrees? As a dancer, what I find is most times you are lacking dorsiflexion. And the reason is that you spend so much time up on your toes in a releve or on pointe. So we spend a lot of time in what's called plantar flexion or releve, right? So that position actually is going to shorten the calf muscle. So we tend to lose a little bit of the opposite direction, which is dorsiflexion. So calf muscles tend to be pretty tight. Ankle mobility tends to be a bit limited just because of the nature of your sport. And so that's something when you have plantar fasciitis, if you are limited in either toe extension or ankle dorsiflexion, it's going to contribute to more problems down the line and continued pain. So when we look at that plantar fascia, again, it goes across the bottom of the foot, but then the line of tissue actually continues right up the back of the leg. So I've got the plantar fascia on the bottom, connects into my heel bone, and then from there, my Achilles tendon and calf muscles connect into the top of the heel bone, which then connects all the way up into the knee. So I have this continuous line of muscle through the bottom of my foot and up the back of the leg. We can even look at hamstrings and glutes, that whole posterior chain. And so if we're tight through there, we actually lose mobility in the plantar fascia, right? So ideally, we have something called the windlass mechanism. And basically what that means is when we extend the great toe, it actually is going to pull on the plantar fascia, which is going to pull on the calcaneus or heel bone and straight up into the calf muscles. And so position of discomfort when you do have plantar fasciitis is this dorsiflexion and toe flexion in combination. And it's a great way to start, it's a great place to start stretching, right? So if I take my ankle and I'm gonna cross one leg over and I'm gonna first dorsiflex my foot. So coming into this direction here, then I'm gonna use my fingers and I'm gonna grab onto the toes and I'm gonna also extend the big toe here. So I'm dorsiflexing the ankle, I'm extending the great toe, and I'm essentially putting the stretch across that entire line of tissue. Plantar fascia up through the calf muscle, okay? Again, if you have plantar fasciitis, this very well could be uncomfortable for you, but it is okay to stretch into this position because it is going to help elongate that plantar surface. You can even take the other hand while you're doing this and give a gentle massage at the same time to the bottom of the foot, and sometimes that's really helpful. So that's kind of the one place that I like to start everybody off at. When you're first experiencing symptoms, you're first trying to start some exercises, this is kind of the first go-to. We do absolutely need to progress beyond that, and for some people, this stretch really isn't enough. Again, dancers are pretty flexible, so you may find as a dancer, you don't feel too much going on here. However, if you are a dancer that dorsiflexion is really limited in, this may be the perfect place for you to start. So it's just kind of trial and error. So make sure you try out some of these tests before you decide which exercises you are going to do. So that windlass stretch is stretch number one. Again, these stretches are also on the free resource. So if you haven't downloaded it yet, I will put a link in the description below so you can download a copy of the PDF with the exercises on it. Okay, so the next mobility that we want to look at is getting even further into dorsiflexion in the ankle. And there's a whole bunch of different ways that we can go about doing that. The first way, I'm just going to show you kind of a classic calf stretch. So I'm sure you guys have seen this one before. If you've watched any of my workshops, I definitely have talked about this one. But I want to make sure that both of my toes are pointed straight forward. No turn out. I know my dancers like to turn that back foot out, but I want you to be completely parallel, okay? And then I'm bending the front knee, lunging forward, trying to keep my heel down on the ground. So I should feel the stretch right up through the back of my leg in the calf, okay? You want to hold this at least 30 seconds when you do it. You can also do it you can do kind of a dynamic stretch. So if you do 10 times back and forth, and then on that 10th time, just hold it for about 30 seconds. That way you get a little movement with the mobility at the same time. So this is going to get the gastroc, which is the bigger muscle in the calf, but there's another muscle underneath that called the soleus, and we also want to make sure we stretch that guy because that one's a little closer into the ankle. So after you do this stretch, You're gonna walk that back foot in. I'm still entirely parallel. And now I'm gonna bend both legs. So you can see I'm still getting my ankle into that dorsiflexed position. But if you do this, you may notice you feel the stretch a little bit closer into the ankle itself. Now I will tell you to increase the stretch here. If you don't feel this, what you can do is put your foot on a step, or you can elevate it in some way. I'm just gonna grab a plate here because it's what I've got. But I can also do this on my stair, and I can stretch just the same here. So I can prop my foot up onto an object or hang it off the step, and then with a straight knee, lean into it. So I'm really working that dorsiflexed position. And then so that's gonna get the gastroc. To get the soleus, I'm going to bend a little bit in the knee, and now I should feel it a little more through my calf, or I'm sorry, through the ankle. So just as a side note for my dancers, if that calf muscle and ankle dorsiflexion is limited, as it is very often with plantar fasciitis, you're gonna find one of the things that you're gonna probably be complaining of is a difficulty getting down into your plies at a good, full depth, right? So when I go into plie, if my calves aren't long enough and I don't have dorsiflexion, I'm gonna be limited here. So in some way, I'm gonna end up compensating. Maybe the heels will pop up, maybe my ankles and knees will roll forward. I'm gonna try to get around my lack of dorsiflexion. So this is a great way, plantar fasciitis or not, to really increase the depth of your plie by getting more dorsiflexion through the ankle. Okay. The last way that I want to show you, make sure that stays standing. Whoop. The last way that I want to show you how to get that dorsiflexion range of motion is through a deep squat or a lunge. And this is the way, so we kind of, the level 1 is when you're sitting with the foot crossed over, pulling back. Level 2 would be doing it on the floor. Level 3 is elevating that foot up onto something, or the toe up onto something. And then this last step is going to get you the most amount of dorsiflexion. So if you're already really limited, I wouldn't necessarily start with this one. So you kind of got to feel it out and figure out which one works best for you. But basically what you're going to do is you're going to get into a nice deep lunge and stretch it. So I'm going to come down onto the ground. I'm going to lunge forward onto my front leg here and trying to keep that heel down. And then I use my arm to kind of give a little extra pressure through my knee as I move that ankle into dorsiflexion. So you can see this one has the greatest range of motion. Just be real careful. I don't want that heel to pop up because then you're cheating around that dorsiflexion. So keep that ankle down. You may feel some pulling through the bottom of the foot at that plantar fascia attachment. It is okay. I don't want you to push too far into pain. However, I do want you to push to a little bit of discomfort because we do need to stretch that tissue. So this is one way. I can also, if I'm really ready for a little bit more stretch, I can get my foot, I'm gonna grab a step stool here. I can get my foot up onto a chair or step stool here and do the same this way, lunging forward. So you can see a nice big range of motion there. So all of those ways those are great ways to increase that dorsiflexion range of motion if you are struggling with plantar fasciitis, or again, if you're just limited in your plies. What this kind of surprises a lot of people that when we're talking about plantar fasciitis, we focus so much on the ankle and the calf instead of right in the foot. But I promise you, it's going to make a bigger difference than you realize. And it's just because of the muscles that are actually involved and how often the calf is actually creating the pressure and the pulling at that plantar fascia insertion point. Okay, so we talked about dorsiflexion. The other thing really quickly I do want to show you is extending that great toe to get more for extension. So the first one that I showed you will work on that first toe extension. So where I just was sitting on the ground, pulling the toe back this way and the ankle. That's going to give you some extension, but again, it's not going to be a whole lot. So to progress that direction, you can do it in standing. I'm going to prop up, again, I'm in parallel. I'm going to prop up onto my back toe and then give a little bend through the knee and try to extend and kind of prop that heel up and extend through that first toe. And so when I do this, I'm kind of putting a little bit of weight through it, and I'm thinking about pressing the front of my ankle closer to the ground to get that first toe to extend here. I could also do it if I come right down into a squat. This is going to be a little bit more pressure, but I can come down into a squat and pop up onto the toes this way. So I'm extending through that first toe. Here, if I need a little bit more range of motion. Again, probably going to feel some pulling through that insertion point of the plantar fascia. It's okay. It is all right to push through some amount of discomfort. Just make sure that it's tolerable. If you're wincing in pain, you're probably going a little bit too far. And you don't want the muscles to actually guard up against you. So you don't want to fight too much pain there. You really just want to go to what a comfortable, tolerable amount of stress while still progressing. All right, so that should take care of the mobility component. So we've got ankle dorsiflexion and first toe extension. Those are the two main things that you are going to focus on mobility-wise for the plantar fascia. Next up, and the most important thing, is we actually have to talk about strengthening. So rehabbing plantar fasciitis is not just about the mobility. It is a piece of it. It is an important piece of it. However, if you stop at mobility and you never implement the strengthening, you are not going to solve this problem for yourself. And I really can't stress that enough, how important the strength component of this is. There's a lot of research that they've put out there. Again, some of this is linked in the blog post that I mentioned, which I'll link in the description below. But there is a lot of information out there, research, that shows that the more that we actually put a high load stress on a tendon, the stronger it gets and the better it will heal. So, and the plantar fascia acts as a tendon does. So we know that high loads and stress on the plantar fascia is going to actually get this problem better. If we don't load it, that's where we kind of get stuck in this chronic pain and inflammation problem. So to strengthen it, we're really going to focus in again on two main areas. We're going to look at the calf muscles, and then we're also going to look at the foot itself. Absolutely, if you are somebody that is struggling with plantar fasciitis, I can't stress to you enough the importance of going and actually getting an evaluation from a physical therapist in your area. Because again, these exercises are great, but there's a lot of other things that go into this. I'm focusing on just calf and foot exercises for you, but you may have some hip imbalances or some quad or some hamstring issues, even all the way up to the core. And so making sure that you're addressing the body as a whole is really, really important, and absolutely outside of the scope of what this workshop is. So please make sure that you do get assessed by a certified or a trained physical therapist or fitness professional. But for strengthening, the first thing that we're going to talk about is really just doing heel raises, okay? So releves. You guys do these all the time, but we're really going to make sure that they are very focused and you're doing them in proper alignment, okay? So if you guys have been following me, you probably have heard me talk about doming a fair amount. I'm not going to go over doming right now. It is a very important concept, especially for plantar fasciitis. But because I've talked about it in so many other places, I want you to head over. I have a YouTube video that shows you exactly what doming is and how to do it. So I'm going to refer you guys over there. But for my releves, I'm going to make sure the first thing I do is create that dome in my foot. And then I want to make sure that when I go up into my releve, my weight is centered in the center of my foot. So about between like the second and third toe, that's where I'm really trying to get it, okay? So as I raise up, my weight, I've got my dome first, and then I raise up, and my weight is staying between the second and third toe. I'm gonna hang on here just so I can stay up there for a minute. So What I'm trying to avoid is going into, of course, the sickled position, as well as I don't want to overcorrect and end up winging my feet. Okay, that's not going to be good for me either. I want to be right in the center, okay? And then you're just practicing doing some heel raises and releves. Now, I know you guys do a lot of these in class, but I really want you to focus on doing them as an exercise every single day at home to help rehab your plantar fasciitis. So what you're going to do is you're going to start with 30 repetitions, okay, with good alignment. Now that also means when I go up into that releve, as I get tired and I start to get closer to 30, no compensating. So I don't want to see those knees bending. I don't want to see your trunk trying to lift you. We're really trying to make sure that it's just the ankles and the calves doing the work for all 30. If you can't get to 30 with good form, take a break, then finish the reps after, and your goal is 30 uninterrupted. So level 1 is going to be doing those right on the floor, okay? Level 2, because again, high stress, high load, we want to put on that plantar fascia. So level 2 is going to an eccentric heel raise. So eccentrics is a slow, controlled descent, okay? And that is really going to put a lot more stress and tension on both the calf and the plantar fascia. So this is where we start to really be getting into those higher loads to help recover. So I'm going to go up on 2 feet, transfer my weight over, and come down on 1 foot. And I want to come down slow. I don't want to just fall down, right? So up on 2, down on 1. And you can absolutely hang on to something for balance when you do these so that you can actually control that descent versus just falling. So level 1, 2 feet. Level 2 is that eccentric. Level 3 is going to be just doing it on a single leg the entire 30 reps. Again, no compensating. So I don't want to see that knee bending or that trunk shifting at all. It's just the straight heel raise. Once you can do 30 on that single leg, time to keep progressing. You're going to bring it to a step or somewhere that heel can be dropped off again. So if I grab we'll use my weight, but again, right off the edge of your stair works perfect. I'm going to repeat that exact same sequence, right? So I can do 2 feet first. Oops, sorry. This isn't as even as a step would be. 2 feet. Then I'm going to go to the eccentric. So I go up on 2, down on 1, and then the last level is just up and down on a single foot. I'm not going to do it because this is not an even surface without sneakers, but you get the idea. Now, I'm not doing that all in one session, of course. I'm progressing to the next level when I am ready. So once I can do 30 in good alignment, I'm progressing to that next step. I could do 30 on 2 feet, I'm going to 30 eccentrics. Once I can do that, I'm going to 30 on a single foot. And once I can do that, I'm coming over to the step or in some way elevated. So each week or each workout session, I am progressing that load that I'm putting through my calf and plantar fascia. And I'm doing it in a very controlled manner that's continuously pushing and progressing my strength. If I only do 30 releves on the floor over and over again, I'm not going to be putting enough force through that tissue that I'm actually going to be seeing any improvement. I'm just going to kind of plateau, which is also why using releves in dance class is not going to be effective, because you want to make sure that you're continuously progressing those loads. So I know you're probably tired from dancing in class, but you still got to come home and do your heel raises this way when you're trying to recover from plantar fasciitis. Okay, so that covers the heel raise part. Another great exercise for plantar fasciitis is actually going to work a little higher up into the leg, doing some deep lunges. So the deep lunge is great because you are going to get that first toe extension and dorsiflexion in the same movement. So we're talking doing lunges here, a split squat as they're called, down and up this way. So if you watch from the side, I have that first toe extended, and as I go down into my lunge, my knees coming closer to the ground, I'm getting dorsiflexion and first toe extension here. I want to make sure that I'm maintaining the dome the entire time I'm working through that motion. And also, I haven't mentioned, I'm barefoot. You can absolutely do these things barefoot. I think, especially for a dancer, you guys are used to being barefoot, and so it's good to practice in the element that you're used to. However, if you are having an acute flare-up of plantar fasciitis, or where there's a lot of pain, I would start doing these things in a sneaker first with a little bit of added support, and then you can progress to barefoot. But it's not wrong to do barefoot, and it's not wrong to do it in a sneaker. That is something that can vary person to person, and it is important you talk about that with your therapist to figure out what the best plan is going to be for you. There are a lot of other exercises that you can do that are going to work higher up that chain, but the biggest thing that I want you guys to start practicing if you are having plantar fasciitis right now are those few mobility stretches and then those calf raises. That's going to be the most important thing to get you started. And then from there, you're progressing into the bigger movements, the squats, the lunges, even deadlifts, things like that. There are a couple other, just kind of, as we've covered a lot in the exercise portion, but there are some other like added pain relief tools that are really helpful for dancers or for anybody that I'm sure you guys have probably seen. So I just wanted to touch on them really quickly. One of which is rolling the tennis ball, or I'm sure you've heard the frozen water bottle on the bottom of the foot. So basically you're just giving yourself a little massage with as much pressure as you can handle. It's a great pain relief technique. It is going to help to a certain extent, give you kind of work through mobility in the plantar fascia, but it isn't enough force to actually change the plantar fascia in any way. So we're not really deforming it or breaking up any scar tissue or anything like that. We're really just doing it more for pain relief if it feels good to do it. So it is something that is okay to do. It's great to keep a tennis ball in your dance bag. However, this alone will not solve your plantar fasciitis. So if you're somebody that comes into me and you say, I've been rolling a tennis ball on the bottom of my foot for the past 3 months and nothing's different, it's probably because you haven't tried any of the actual exercises, right? So just doing manual techniques like this, they're helpful, they're a piece of the puzzle, but they will only give you short-term changes. The strengthening is what's going to give you long-term change. Lastly, I just want to touch on the foam roller. I told you guys a lot of dancers are often surprised by how much the calf is actually tied into their plantar fasciitis or their foot pain. So most of the time people come in and they're like, no, it hurts right here on the bottom of the foot. And so that's where they've been spending all their time, massaging it, exercising it, whatever they're doing. Very few people actually have checked up in the calf to see what's going on there. But I can tell you, doing this for a long enough time, pretty much every single dancer that comes into me that has foot pain, the first place that I start, I check their calf and I see, are there any trigger points or are there any sore spots up in the calf? And I would say probably 100% of people that have plantar fasciitis have something going on in that calf. And that's just because, again, of where those muscles attach and the way that they pull on the heel bone and the plantar fascia. So not very many dancers realize that they need to attack the calves. So an easy way that you can start doing something at home, aside from going in and having a therapist actually do some manual work with it, is just using your foam roller. So I just wanted to touch on the proper way to use the foam roller. Just like the tennis ball, it is only a piece of the puzzle. It is in no way going to heal your plantar fasciitis. You could do this every day for 5 years, and you probably would still wake up with plantar fasciitis because it's not solving the reason that the plantar fasciitis happened. It's just giving you a temporary pain relief. So as long as you know that going into it, use it as a tool, but then do your strengthening exercises on top of it. So to use the foam roller, I'm gonna go from my ankle, so the back of like where my Achilles is, all the way up to the back of my knee, and that's where I'm gonna focus the rolling. You don't need to stay here all day. 5 to 10 times up and down the leg is plenty. Any more than that is not going to make a change. Or it's not going to make any additional change that 5 to 10 times wouldn't. So level 1 or step 1 is up and down the calf. The next thing I'm going to do is when I find a spot that feels really tight and restricted, like a little trigger point, I'm going to stay on that spot, and then I'm going to roll my calf side to side. So I've gone long ways over that spot, and then I've gone side to side. If you need a little extra pressure, you can use the other leg to give it. Don't push as hard as you can, because you will find your muscles kind of spasm up and guard against you because they're trying to protect you. So tolerable amount of pressure here. The last step is I'm going to stay on that spot that feels pretty restricted, or I can go find a different one that feels restricted. I'm going to hold the same amount of pressure there, give a little extra help from the other leg if I need it. I'm going to move it just so you guys can see. And then I'm going to point and flex my foot. I'm not pressing any harder. I'm not digging in as hard as I can. I'm just getting the muscle to contract and relax, which is actually going to get the layer of tissue to glide past each other at a deeper level. Pushing harder does not make those tissues glide deeper. Contraction will actually get more of the tissues to glide at a deeper level. So this last piece is actually my favorite one to do for people. If you only had time for one thing, I would pick this one. Okay, so we've kind of gone over mobility exercises, we've gone over the strength exercises, and then some extra manual cues or manual tools that you guys can use. Lastly, I would say, the biggest complaint of people that have plantar fasciitis, kind of the common symptom, is waking up in the morning. That's when people have the most amount of pain. Those first few steps out of bed. As somebody that has struggled with plantar fasciitis in the past, I totally can sympathize with you. It is not comfortable. The reason being is when we sleep, most of the time, naturally, our feet fall into a plantar flexed position, kind of this way. And so that tissue naturally is in a shortened position here. Remember, I said it's stretched when we extend. So I've been in this shortened position all night while I'm sleeping, and then I get out of bed, and I extend, and that tissue is being pulled and stretched. And so there's so much extra tension on it. That's why those first few steps, you kind of feel like the zombie, right? So what you can do to combat that is first thing in the morning, before you even get out of bed, stretch the ankles, okay? Try to get that tissue warmed up. So you can do some ankle pumps, really focusing in on the dorsiflex position, so pulling into this direction. You can sit on the edge of your bed, do some of that windlass stretching that I showed you. And then when you get up, you can, go ahead and walk around and get some mobility, or stay standing for a minute and just kind of get that tissue moving. So some deep knee bends, maybe bending forward, touching the toes, kind of get it slowly moving before you start taking those steps. And that probably will help relieve some of that discomfort that you're feeling first thing in the morning. You get moving earlier on, it's going to warm those tissues up. You're going to feel better throughout the day. All right. So that's about everything I wanted to cover for you guys today. Really, the thing that I can't stress to you enough is the importance of the exercises and the strengthening component. So if there's anything you take away from today, it's that piece. As I mentioned, you can head to my website or a link in the description to get a copy of the free PDF download with some different exercises in it, things we didn't go over today. You can also head to my blog. There's a post with some ideas there, as well as don't forget to check my YouTube page, because I put a lot of new videos up every week that are different exercises and things. So any of the foot and ankle exercises, even the hip and knee things, can be really helpful for this type of issue. So if you're looking for some new exercises to add to your routine, you can find them either on my YouTube channel, or they're also linked on my website. So I hope you guys found that informative and helpful. As always, please reach out to me if you have any questions about anything. Let me know if you have any suggestions for future workshops, and I can't wait to see you guys soon. Take care.